Okay, it's career time for another letter for OET. This is a new one for me. I've never seen this one. It's for nursing, so we'll take a look at that. First things first, though, disclaimer: copyright, fair use, etc. Because we're using some materials from somewhere. I don't know if it's from Med City International Academy. I've never heard of them. But anyway, fair use, so, don't bother writing to complain. So, what's the task? What are we going to do? So it's a referral letter to a practice nurse to give information about condition of the wound, treatment, and requesting continuing care. So practice nurse, right? What's the plan? So let's have a look at this. I haven't seen this one. So you're in the emergency department, Mrs Crawley presents with a laceration on the knee, some bruises, a bit of painage, and was it? Let's have a look again. So this is a bit confusing-ish. Hang on. Okay, right. So the 2nd of January, right? So you came on the 2nd. Okay. Bruises. Yeah, there. What did you do? Come back on the 6th. Review for wound suturing. Wound healing progressing well. Sutured. 14 days. Referral letter to practice nurse. Information. Oh, okay. Seems relatively straightforward. Let's take a peep at this. Now, let me see. First things first, right? Pronouns. So he, she. So you should have the do. Now, right? If these are proper case notes, I keep saying this. Use stuff from OET.com. Don't use random stuff on the internet or wherever you obtain them from. OET case notes are proper, right? It will be the same format as in the exam. So they'll give you the DOB. So you usually put the RE line, then it'll have the DOB. And in your purpose, you put Mrs. Patient, aged 71 or whatever. You can sometimes put name, age, and occupation if that's important or relevant. So I'm writing this letter. Okay, you don't have to say it's a letter. I can see. All you've got to do, I'm writing to refer. Now, is it a referral though? Is it necessarily a referral? Let's have a look. What's it say? So it says right referral. So right, so again, this is why you need to use proper materials, not random internet stuff, because it is kind of a referral, but you're giving information, so you're updating or you're informing. All right. So although this is right a referral, you don't have to say this is a referral. It says to give information about the condition of a wound. Okay. So I'm not going to go through the criteria again, which I have done on many occasions. Go to OET Ultimate Writing Guide. You can download it from OET.com. It tells you, personalise. That's how you get good scores, right? Don't just use the same stuff that you've seen on 1,000 letters on the internet. Use your own stuff. It tells you in OET Ultimate Writing Guide different verbs. So I'm writing to inform you. You don't have to say this is a referral. We kind of get that. To refer her for what? So I'm writing to inform you of the, what's it say? I'm writing to inform you about the wound condition of Mrs Crawley, who was recently admitted due to a wound sustained, blah, 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 and to request continuing care. You could do something such as that, and that will get you a higher score than simply using the standard thing that everybody uses, that you've no doubt seen in 1,000 letters on the internet. So, to refer Mrs Judith Crawley, who has presented, well, okay, but she was, again, these notes that are not from OET. So, usually it's presented if they come to see you in your clinic, say, they present, oh, doctor, I've got such a pain, blah, 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 right? But here it seems that she was admitted, because it says, like, you're a nurse in the emergency department. Okay, so she could have presented, but usually if it's emergency, you might say admitted, presented. You could do, but again, presented, that's usually when they come, to see you at a clinic, etc. So, but okay, because it's emergency, it doesn't look like she was kept in. Doesn't look like it. Looks like she just came in and had some treatment and then she went home. But again, you need to be very careful. That's why I keep on saying, get proper notes, and then you won't have these issues. So writing to refer Mrs Judith Crawley, who has presented. Now, right, present perfect. Why are you using present perfect? So we use present perfect when it's indefinite time. Okay, so here we're using simple past in passive because we know exactly when. But presumably, because we know when she presented, though here you've put admitted. So I'm writing to refer, I'm writing to inform you of the condition of Mrs Judith Crawley, who was recently treated for laceration of the right knee, and to request further treatment, etc. Right? So you could get some better marks for that purpose, right? If you do it nice and clearly. So I would use a simple past there, but you don't need to say who has presented, and here you have was admitted. So right to inform you of the condition of Mrs Crawley following her recent injury to the right knee. You could do something such as that. Now, order of importance, as I keep saying, your paragraphs need to be in order of importance, and every sentence within the paragraph needs to be in order of importance. So, Mrs Crawley was admitted on January 2nd. She fell down on rock surface because she forgot. Right, is this the most important sentence in your paragraph? How it occurred. Do I care how it occurred? Too much detail. She fell down, right, was admitted. If you wanted to include this, you would say, due to a fall on a rocky surface. Why do I need to know that she forgot to take a walking stick? That's irrelevant. Right? So conciseness and clarity part of the score, right? So that purpose could certainly be reworked. You've got present perfect and you've got the wrong pronoun there. And you've got too much information here because she forgot a walking stick. Well, okay, who cares? What I want to know is what happened while she was in hospital. So I want to know about the condition of the wound, how you treated it, and what you want me to do in future. That's it. That's all I'm interested in. Anything else is irrelevant. Take walking stick. She has had. So why is it present and perfect? It's simple past. She had bruises on the thigh and knee and 4 centimeter deep laceration. Also, there were some sand particles present in the wound, and taken wound swab for test as well as removed sand particles. Right, this is not good English at all. Right, so there's two. I mean, I think is that one sentence. So Mrs Crawley was admitted to Johnson in 2024. She fell down the rock surface because she forgot to wash it. She has had bruises. She had bruises on the thigh and the knee, and a 4 centimetre deep laceration. Sand particles presented in the wound. What's that got to do with me? And a wound swab was taken, should be passive, for testing, as well as removed sand particles. So you've got mixing of information here, right? Although there was some sand particles presented in the wound, as well as removed. So, you could just say, though I wouldn't include it. I'd just say, right, so Mrs Crawley was admitted or presented following laceration injuries sustained during a fall onto a rocky surface. The wound was cleaned of sand, and, does it matter that I know what the technique to remove the sand particles actually was? Right? I mean, what use is that information going to be to me? Yeah? If we go back to that, right? So I want to know what's the condition of the wound, what happened, is it progressing well, is it healing well, what did you do, etc. All right, that's all. So you don't need to tell me about, now, instead of saying, and a wound swab was taken for test, well, okay, but why don't you tell me what the test actually showed? People keep on putting these waste of words in a sentence. A test was ordered, so-and-so tests were requested. Simply, that knowledge is useless. What I want to know is what the results of a test were. So you could say something like, wound swab test showed, a wound swab test revealed. Now that's better for conciseness. Instead of saying so-and-so was tested, so-and-so tests were organised, then later you tell me what the results of a test were. That's a waste of words. All right? So anyway, that needs some rewriting. She had bruises on the thigh and the knee and a 4 centimetre deep laceration. The wound was cleaned for sand particles, or sand particles were cleaned from the wound. Applied antiseptic cream was applied, and tetanus injection was administered. So you need to watch this passive also. Additionally, prescribed. So if that's active, who prescribed it? So that's why we make it passive. Additionally, therefore, antiseptic cream and done waterproof dressing was applied. Additionally, cefaxin was prescribed and tetanus injection administered. Right? That's passive. The way that you've written it here is active, but you haven't said who performed the action, so that's why it should be passive. Okay? So we've got quite a few things here, right? We've got present perfect, we've got wrong pronouns, we've got some syntax, word order here, we've got misuse of passive, that doesn't work either. So there's a fair bit of grammar to have a look at. Mrs Crawley lives alone. Okay. She has a history of osteoarthritis. Okay. Besides, she taken? So either she has taken, or probably present perfect continuous. She has been taking, because she hasn't stopped. All right. So you've got verb forms here, all over the place. You could follow up on a wound, checking and kindly provide wound dressings. Please note acid removers after 14 days if the wound is healed. So there's plenty of grammar here. There's plenty of stuff here. Some, that purpose needs reworking. You've got sentence organization. So there's some organization issues. You've got the purpose. You've got organization. You've got lots of grammar, sentence construction, etc. So there's quite a few things to work on here. Okay. Right. Well, I hope that is of some assistance. So I'll see you next time.